Part 1. Please find a quiet place to sit or lie and to listen to this audio. Once seated or lying, close your eyes. Focus your attention on your breath. When you are ready, inhale slowly. Let the air fill your lungs. And then exhale slowly. Let the air escape from your lungs. Inhale again. And then exhale again. Notice how your stomach rises as you inhale and falls as you exhale. Rises as you inhale and falls as you exhale. If your mind wanders, don't be concerned. Just gradually shift your attention back to my voice. Sometimes, however, our body does not feel as relaxed. For example, our calves might feel tense, our legs might feel shaky, our stomach might rumble, and our chest might feel tight. Why do we experience these sensations? Why has our body evolved to generate these responses to stressful events, such as a barking dog or a furious manager? These bodily sensations, although unpleasant, are often beneficial. For example, in response to a barking dog, the muscles of our calves might contract, helping us run. Our calves thus feel tense. To experience this tension, point your toes upward. Feel the tension in your calves. Now release your foot. Feel the tension subside from your calves. In response to a furious manager, the muscles of our chest might contract, helping us fight if necessary. Our chest thus feels tight. To experience this tension, press your chest forwards. Feel the tension in your chest. Now release this posture. Feel the tension subside from your chest. Furthermore, in response to most stressful events, blood needs to flow from organs that are not needed immediately, such as the stomach, to the muscles. So the tummy feels different to usual. But how does your body know when to tense the calves, tighten the chest, shift blood away from the stomach, and so forth? How does your body know which circumstances are stressful enough to elicit this sequence of bodily reactions? In essence, many regions of your brain can appraise whether or not the circumstances are stressful. These regions then essentially ask another region of the brain, called the hypothalamus, to elicit these bodily reactions. And two pathways called the sympathetic nervous system and HPA axis evoke these bodily responses. If this sequence of reactions seemed complex, do not worry. We will now help you construct some images that will clarify this sequence of events, at least to some extent. Part 3. How do we determine that some event or circumstance is stressful? How do we decide, for example, whether a barking dog is dangerous or not? How do we decide whether our manager is shouting angrily or just excited? Many regions of the brain help us determine whether some event or circumstance is stressful. Some regions determine whether the circumstance differ from expectations and therefore could be harmful. Other regions help us calculate the likelihood of some problem. But despite this complexity, many of these regions eventually transmit information to the amygdala and surrounding parts of the brain. To visualize the amygdala, imagine you could drill horizontally from someone's eyebrows into the brain for about 5 centimeters. On each side, you will notice a structure behind this point that resembles an almond lying down. This almond is called the amygdala. Indeed, the word amygdala is derived from a Latin word that means almond. As you imagine these two almonds in the brain, one on each side, repeat the word amygdala. 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 When the amygdala is activated, individuals tend to direct their attention to objects, features, and details in the environment that often coincide with threats or hazards. For example, imagine yourself sitting quietly in the backyard of a suburban house. If the amygdala is not activated, your attention might drift towards the gentle swaying of a tree or the fluffy clouds above. In contrast, if the amygdala is activated, your attention will shift rapidly towards the sharp teeth of the family dog, or towards a curvy twig that resembles a snake. Consequently, the amygdala coincides with feelings of fear and trepidation. Sprouting from the amygdala, like a small weed, is another region called the bed nucleus of the stria terminalis. You do not have to remember this name. But to remember the bed nucleus, perhaps imagine the shape of a bed implanted in your head about 4.5 centimetres behind each eyebrow. Whereas the amygdala orients attention to specific objects, features and details that coincide with threats and hazards, the bed nucleus orients attentions to the settings or circumstances that tend to evoke unpleasant feelings. When this bed nucleus is activated, people tend to feel apprehensive, agitated or anxious more generally, rather than afraid of a specific object. Part 4. In short, the amygdala and surrounding areas help people identify threatening or stressful circumstances. But how do these regions then activate changes in the body, such as a tensed calf or a tensed chest? In essence, these regions, such as the amygdala, transmit information to the hypothalamus, a structure that sits a couple of centimetres above the amygdala. The hypothalamus, although as small as a cashew, comprises 15 or so distinct clusters of neurons. You can visualise the hypothalamus as 15 or so tiny jelly beans, each unique in size and oriented at various angles, crammed together. In particular, many neurons in the amygdala and surrounding regions send axons to the hypothalamus. The amygdala and surrounding areas can thus inform the hypothalamus that circumstances are threatening and stressful. That is, action potentials or sparks of energy that travel from the amygdala to the hypothalamus indicate the setting is stressful. Perhaps you can hear the amygdala directing threatening music to the hypothalamus, like the music in Jaws. In response, the hypothalamus prepares the body to respond to this stress. Specifically, the hypothalamus utilises 2 pathways to elicit these responses. Part 5. The first pathway is called the sympathetic nervous system. The hypothalamus sends axons to activate clusters of neurons in the middle sections of the spinal cord. Specifically, imagine a set of neurons in the hypothalamus, a region that is embedded in the top part of the brain called the cortex. Now visualise an action potential like a spark of energy travelling down the axon from the hypothalamus to the spinal cord. In particular, the axon ends near a bunch of cell bodies just to the left or right of the spinal cord, midway down the back. Many axons also emanate from these cell bodies and travel to the various organs. In particular, visualise action potentials or sparks of energy travelling from the spinal cord to all these organs such as the heart, lungs, sweat glands, stomach, intestines, bladder, and adrenal glands, the glands just above the kidneys. These action potentials enable the person to either flee or fight. For example, after these action potentials reach these organs, you can imagine the heart beating faster and faster, driving the blood into the muscles. Watch the lungs expand and contract vigorously and rapidly. Observe sweat oozing from glands embedded in the skin. And notice how the adrenal glands, located above the kidneys, near the hips, produce more adrenaline, or hormone that further increases heart rate, dilates pupils, and causes other changes that facilitate fight or flight. In addition, these action potentials diminish the activity of organs that do not help the person flee or fight. For example, these action potentials dampen activity in the stomach, intestines and bladder. These organs all rest quietly as the heart and lungs work vigorously. All these changes unfold within seconds. After someone identifies a threat or hazard, the heart thumps faster, the lungs work harder and the body changes almost instantly. Part 6. The second pathway is called the HPA axis. HPA axis means hypothalamic, pituitary and adrenal axis, but for now we will refer to this pathway as the HPA axis. Whereas the first pathway involved action potentials, the second pathway primarily involves the production of hormones, that is, chemicals in the blood, and therefore this second pathway does not change the body as quickly. Specifically, after the amygdala informs the hypothalamus that a threat is imminent, clusters of cells near the front of this hypothalamus, called the paraventricular nucleus, produce a special chemical. You can imagine the hypothalamus embedded within the top part of the brain, releasing a chemical that resembles long coiled ribbons. This chemical is called corticotropin-releasing hormone. As you imagine these long coiled ribbons emanate from tiny jelly bean embedded within the cortex of the brain, repeat to yourself, corticotropin releasing hormone, corticotropin releasing hormone, corticotropin releasing hormone. Part 7. But you don't need to remember the name of this hormone for now. Merely imagine this hormone emanating from the hypothalamus into small blood vessels. Now, these blood vessels do not convey this hormone to all parts of the body. Instead, these blood vessels merely carry the hormone to a small gland inside the brain, just under the hypothalamus, called the pituitary gland. The pituitary gland resembles two cloves of garlic, but is only the size of a pea. After a moment, the long coiled ribbons, the corticotropin releasing hormone, reach this pituitary gland. And in response, you can imagine the pituitary gland produce a similar hormone itself called ACTH. Now, ACTH stands for adrenocorticotropic hormone. Perhaps visualize this hormone as like a small key. As you visualize this hormone emanating from the front of this pituitary gland, the gland that represents or resembles two garlic cloves, repeat the term ACTH. 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 This hormone then enters blood vessels and travels around the body. Part 8. So what is the role of this ACTH? What is the effect of this ACTH on the body? ACTH attaches to receptors in the adrenal cortex, the outer shell of the adrenal glands, just above the kidneys. You can imagine ACTH resembling a tiny key floating gently in the bloodstream and then eventually attaching to a strange lock in the adrenal cortex. After attaching to this lock, the cells in this adrenal cortex produce another vital chemical called cortisol. Indeed, this entire pathway from activation in the amygdala to the production of hormones in the hypothalamus and pituitary gland is actually designed to produce this vital chemical into the bloodstream, cortisol. Perhaps you can visualize this cortisol as small vitamin tablets streaming from the shell or cortex of the adrenal glands just above the kidneys. As you attempt to maintain this image, repeat the word cortisol, cortisol, cortisol. So what is the role of this chemical? How does cortisol affect the body? Whereas adrenaline prepares the body for more fleeting threats or hazards, cortisol prepares the body for more enduring threats or hazards. Threats or hazards that might last hours or even days, weeks and months. To illustrate, imagine this cortisol resembling small vitamin tablets radiating from the adrenal cortex, just above the kidneys. Then visualize this hormone floating in the blood towards various organs and tissues. Cortisol then travels to your liver and to your muscles. This cortisol then enables your liver and muscles to convert a substance called glycogen to glucose. Therefore, cortisol increases the level of glucose in the blood, a sugar that helps energize other cells and organs. In short, cortisol helps energize the body and brain. Furthermore, during threatening and stressful circumstances, people are often exposed to unfamiliar toxins, bacteria, viruses, and other dangers. In response, the body activates many white blood cells and produces chemicals that are designed to eradicate these toxins, bacteria, and viruses. But these white blood cells and chemicals, if excessive, can also damage the body. So cortisol actually diminishes this immune response. Consequently, variants of cortisol are often administered to diminish inflammation. Part 9. Yet excessive cortisol can damage the body. For example, if cortisol is excessive, cells are thus more energized than usual, and this excessive stimulation can damage cells in the hippocampus, for example, a region of the brain vital to memories of the past. So to ensure cortisol is not excessive, the body has developed a clever safety procedure. In particular, cortisol in the blood eventually drifts to the hypothalamus in the brain. This cortisol then prompts the hypothalamus to produce less corticotropin-releasing hormone, the hormone that ultimately initiated the production of cortisol. So consequently, cortisol, in essence, inhibits its own production.